How much does a breast MRI cost for breast cancer screening? If you're wondering about the cost of a breast MRI for screening, especially if you're at high risk, you're not alone. Breast MRI is a powerful tool for early detection, but it can be more expensive than other screening options. The price usually falls between about $545 and $2,439. On average, many people pay around $950 to $1,000 in the United States. The wide range depends on where you live, which healthcare provider you visit, and whether contrast dye is used during the scan. Contrast dye helps improve the accuracy of the MRI but can add to the cost. For comparison, a mammogram typically costs between $139 and $360, making MRI significantly more expensive because of the advanced technology involved. Insurance coverage can vary a lot. Some women with insurance might still pay hundreds of dollars out of pocket. About a quarter of women might pay more than $376 per MRI. This is important because insurance does not always cover breast MRI screening as fully as it does mammograms. The Affordable Care Act requires no cost-sharing for standard screening mammograms for average-risk women, but coverage for high-risk screening with MRI is less consistent. Costs can also differ depending on your location. For example, in some states like New Jersey, breast MRI prices range from around $600 up to about $1,000. Usually, contrast-enhanced MRIs do not add much to the overall cost compared to non-contrast scans. Guidelines recommend breast MRI for women at high risk of breast cancer, such as those with inherited gene mutations like BRCA1 or BRCA2, or with a strong family history. Although MRI costs more per exam, it can help catch cancers early when they are easier to treat. This targeted approach may also help reduce overall screening costs by focusing on those who need it most. In summary, the typical cost of a breast MRI for screening is near $1,000, but your out-of-pocket expenses depend on your insurance and where you live. Because MRI technology is more complex and specialized, it naturally costs more than a mammogram. If you're considering this screening, talk to your healthcare provider to understand your options and coverage. Remember, early detection saves lives, so discussing your risk factors and screening choices with a medical professional is always the best step.